The instructional notation includes is used to further define or provide examples for clarification. Includes notes appear in Volume 1, Tabular List. Includes notes can be found in the beginning of a chapter, section, category, subcategory, or subclassification. The placement of the notation determines the code range that is governed by the notation. If the notation is found at the beginning of the chapter, that notation applies to the entire chapter. If the notation is found at the beginning of a section, then that notation applies to only that section. If the notation appears at the beginning of a category, it applies only to that category, and so on. Excludes notes appear in Volume 1, the tabular list, and signify that the condition listed is to be coded elsewhere. Exclude notes can be used when a condition cannot be assigned if a specified associated condition is present. Like inclusion notes, exclusion notes can be found at the beginning of a chapter, section, category, subcategory, or subclassification. The instructional notation use additional code indicates that more information should be added to provide a more complete picture of the diagnosis. It signals the coder to add a second code to fully code the diagnosis. When the instruction reads use additional code, the additional code should be sequenced second. Code first underlying disease is a phrase that indicates the code selected is not intended to be used as a principal diagnosis. This notation must always be followed as it instructs the coder to identify an underlying disease or cause that is present. Therefore, two codes are needed to fully code the diagnostic statement. The two codes must appear in the order stated. The underlying disease is sequenced first. Code, if applicable, any causal condition, is found in Volume 1, the tabular list. This note indicates that the code may be assigned as the principal diagnosis if there is not a causal condition or if it is not known. If there is a causal condition, it would be sequenced first. When reading the words and with in the ICD-9CM, pay close attention. The word and can mean and or, which means that if two conditions are joined with the word and, one or both conditions may be present. In the example, chronic disease of tonsils and adenoids. The patient may have chronic disease of the tonsils or chronic disease of the adenoids, or both chronic disease of tonsils and adenoids. The word with indicates that two conditions are included in the code and both must be present. Chronic tonsillitis and chronic disease of adenoids. The patient has both conditions. Cross-references are used in Volume 2 Alphabetic Index. The cross-reference C is an explicit direction to look elsewhere. Follow this instruction. C also directs the coder to look under another term if all the information cannot be located under the first main term. And C category directs the coder to look in Volume 1, the tabular list, because the alphabetic index gives no further explanation or no further information. Eponyms can also help to locate a diagnosis easier. An eponym is a disease, procedure, or syndrome that is named for a person. Codes can be found in Volume 2, the alphabetic index, by looking under an eponym.